Tuberculosis has infected 1 out of 3 people worldwide and continues to affect your community. Thank you to the courageous men and women who are sharing their stories in the hopes of spreading knowledge and understanding.
I had a gland, swollen gland in my neck, so I didn't know what was the cause of it. I went to the hospital. So they told me they were going to take me to Saskatchewan for some kind of a operation. I went there and they cut off that gland and they told me I had TB. So I was going to go across to that old sanatorium.
And they told me that I have TB. So that's when they sent me out to a sanatorium in Prince Albert. And then 2 years later, in September 1955, I was back because I was better.
They gave you needle shots every morning and evening. So it hurt, but I got used to it. I was about 19 or 20 at that time.
I guess I was coughing too much. That's why they took me to the hospital. I remember the old hospital, they have that x-ray lab, so they took an x-ray on me. That's where they found out that I have TB.
I didn't stay there that long, only about 6 or 7 months. So it's not like the old days when they say they're 3 years, some 5 years. They don't get out of bed. It's not like that.
It is very important to see the doctor right away, especially when you're coughing too much and when you really sweat and stuff like that. It's better to go to the hospital right away.
Well, my advice is people to go if they have a cold or something, cough, go and have it checked out or TB test. But it's not like the old days now, they can cure you easy. Because in the old days you had to be in bed for 3 years, that's a long time. You need a lot of pills too.
My grandma had TB and I lived with her, so they had to all of us who lived with her had to get the shot, and then they said that I had the germs and I needed to eat the medicine. There's 5 of us who lives with my grandma. I didn't get that much symptoms, like I didn't know I had it until I got the shot. I was kind of nervous because I didn't want to take the medicine. My cousins told me that they didn't like it, and because I had to take 6 pills 2 times a week. 2 of them were pretty big, and the rest were okay. But they were like the powder ones, so they kind of melt on my tongue. I had to take it with milk. I heard a few stuff about it, but I didn't think it was like a really bad thing that I had to take medicine for it. It could get worse, and if you don't take the medicine for it, it could get worse and other bad stuff could happen to your body.
TB is a really unique disease in that it often comes on in a slow, incremental, almost sneaky approach. It grows very slowly, and because of that, the signs and symptoms are often a slow onset.
So the signs and symptoms of tuberculosis are a cough for 3 weeks or more, unexplained fever, weight loss, feeling tired. Again, a lot of these symptoms, it could be something else that's going on, but I would probably be doing a history with the person first, and then I'd be checking them out for tuberculosis.
If you notice within yourself or within anybody else in your family, your children, your parents, your aunts, your uncles, your siblings, of any of those signs and symptoms, the best thing to do is encourage them to get checked. The sooner you get on it, the better the outcome for everyone.
There's different things we do to find out if you have tuberculosis. If you're eligible for a tuberculin skin test, I would do that. A good history, asking about past experiences with or contact traces that you've been on, signs and symptoms, a chest x-ray, and sputum if you have any symptoms.
TB is very treatable. TB grows very slowly, so oftentimes treatment, if you have TB germs that are growing, Treatment can last anywhere from 6 months to 9 months, even up to a year in some cases. TB right now in 2014 is treated in people's homes and in their community. The good news is if you're diagnosed with TB and you're not infectious, often you can still work, you can still trap, you can still have your traditional lifestyle. You will be assigned a TB support worker, much like we have family support workers. And these TB support workers will work alongside you for the duration of your treatment, such that it can be done at home with minimal interruption in your everyday life and routines.
The TB workers are actually the backbone of our whole program in Saskatchewan. Basically, years ago they were hired, I think it started in 1986, and they were really hired to do direct observed therapy and to support the clients through treatment, which can take anywhere from 6 to 9 months.
Our goal is to support that client through their treatment. We just want to see that person get better, so we will do what we have to do to ensure that that client gets the best outcome.
For more information, talk to your local nurse or TB worker or check out www.tbfacts.org.